Dear colleagues, dear Presidium, we want to present our report, Multiparametric Neural Network Clustering, in prediction the risk of surgical complication after revascularization of great arteries of the lower extremities. Numerous studies have been conducted with the aim of the solving of the prevention of complication by taking into account patient parameters and developing relevant preventive risk measures. However, the problem of using them in practice and of comprehensively considering a multitude of risk factors remained unresolved. We analyzed the examination results of 397 patients with occlusive atherosclerosis of the great arteries of the lower limb. To optimize the prediction of the risk of postoperative sequela, neural network clustering was performed on 190 patients applying the software NeuroXL classifier for a more detailed analysis on the change in the result of each group. Depending on the treatment performed, patients with various forms of stenotic occlusive lesion of arteries of the lower extremities were divided as follows. Group number 1, 67 patients who underwent open surgical intervention. Group number 2, 40 patients who underwent endovascular surgical interventions. And group number 3, who underwent hybrid surgical interventions. There is 12 patients. An analysis of the results of clinical laboratory observation, there is average values entered to the NeuroXL classifier, indicator of 72 patients. And after that, another one group, 47 patients who underwent open endovascular and hybrid surgical intervention with instrumental method. Stage 1, neural network clustering of results of clinical and anamnestic indicators. Among the postoperative complications, the first cluster, thrombosis of the reconstruction segment, myocardial infarction, and suppuration of the conduit were more common. These show in a cluster weights and cluster profiles. Stage number 2, neural network clustering of the results of laboratory instrumental indicators. At the same time, we found in the second cluster, among the postoperative complication, thrombosis of the reconstruction segment, myocardial infarction, and suppuration of the conduit were more common. In this group, the highest proportion of vascular protesis was found. This also proved in a cluster weight and cluster profiles. Stage 3, neural network clustering of ultrasound results. Among the postoperative complications in the third cluster, we found thrombosis of the reconstruction segment occurred more often. The result of clustering of the indicators of ultrasound examination, cluster weight and cluster profiles. After we done these three stages, we formate of the coefficient and points. First scale, there is a scale of the analysis. The maximum amount respectively was 40 points. Coefficient convert to the 10-point scale, and each indicators from the cluster analysis of anamnestic laboratory ultrasound examination indicator of the symptomatic and controlled limb enter into NeuroXL classifier program in order to determine their point values. This is the analysis indicators, coefficient and scores, and indicators of the symptomatic contralateral and contralateral limb. Stage 4, we develop a web page based on a scoring system for assessing the risk of developing postoperative complication. Anamnestic parameters, laboratory indicators, ultrasound examination indicators of symptomatic and contralateral limb. Total points in all areas will calculated automatically, and low risk from 1 to 10, moderate 11, 20, high risk 21, 30, and very high 31, 40. Conclusions. The analysis of clustering of the anamnestic indicator, we found that the most important is combination of age, extracranial atherosclerosis, diabetes, respiratory failure, and oncological disease. In analysis result, the most important is combination of erythrocytes, monocytes, creatinine, AST/ALT, bilirubin, potassium, lipoproteins, and cholesterol. And the most important combination in ultrasound is stenosis or occlusion in femoral superficial segment, stenosis or occlusion of anterior tibia artery, and contractile index less than 0.3. And among postoperative complications, meet more often thrombosis, myocardial infarction, suppuration of the conduit. The predominance of the above-mentioned complication occurred when using an allograft. Thank you for your attention. Glory to Ukraine, glory to the heaven hero.